Okay, so this video I wanted to do a very quick rundown on your Cleft Care Team. Sometimes once you've had the cleft diagnosis, it kind of feels like a bit of a community pregnancy because of the amount of people that you end up seeing and they're actually assigned to your baby. Here in the UK we have 9 centres of excellence for cleft care. So your team may not necessarily be in the area that you live, but it will be the closest team as to where you are. Now the first person that you'll probably speak to is your cleft nurse. Now they very much become your liaison and your go-to, and the person that will come and see you at home antenatally, give you all your feeding information, and they're very much the liaison between the team as well. So that's your cleft nurse. Then you have your surgeon, who is the person that's going to be doing the repair work for your baby, who you will see as in their pre-op assessments, so they get to meet the baby and kind of make a bit of a care plan. You have your orthodontist, so if your child has a cleft palate, particularly they are the people that do the plates for cleft palates and the lip straps as well, and then they're involved with the orthodontic side of dental work. Then you have your speech and language therapist, so although you're not going to be working with them directly in the immediate, they tend to sit on the panel on the board when you see them, even antenatally, so you meet them very, very early. And finally, there's a clinical psychologist that sits within the team who is there to use if you are struggling with the diagnosis and helps you kind of deal with things mentally. So my experience of the team that we met and that we currently have is nothing but praise. We've been so lucky. We ended up having like 4 nurses, and that was the first 2 left due to retirement, who'd both been doing the job for like 15 and 20 years. The third nurse, we were actually her first cleft family, and she was absolutely amazing. And then there was a 4th nurse who will had just had his 2nd surgery, so we didn't actually see much of her. But we still come under the team, and they are just the nicest people. All they want is the best outcome for your baby. Particularly our orthodontist and his HCA, who coincidentally was the HCA for my orthodontist. So I've known her for, I want to say like 20 odd years myself. It's actually just coincidence, but it's really nice for me to know her from my own care, and now she's helping us with our son, so that was really, really lovely. We spoke to our speech and language therapist at Will's post soft palate repair meeting for a little bit of a one-to-one, so she gave us some ideas of what he might struggle with and what we need to work on and how to do different bits and pieces. Now, in reference to the psychologists, I haven't used them, but I've met them and they are lovely, and I've actually spoken to other mums in my area who have used them, who have said they're brilliant, they're really, really lovely. So I think really you just have to use the team as much as you can to get all the information that you might need or you might want. You know, and it's not very often that you have like a mental health attachment to a team. So I would say if you're struggling or you just need a bit of extra support from somebody that's not necessarily in your immediate circle, definitely use those resources. I think I was possibly a little bit too, not defiant, I can't really think of the word, but I very much thought, I've got it, I can handle this. But actually it may have done me some good to sort of approach that psychologist and just say, look, this is what I'm thinking, do you think this is a good way of doing it, or can you make any recommendations? So I would kind of say just use the team as much as you need to or you want to, because that's what they're there for, and they understand the ups and the downs that you might go through. And, you know, even in reference to like strapping or, you know, plates or whatever, just contact them. They're there to be used to get the best outcome for your baby. And I think really what I'll end on is the fact that having experienced the Cleft team as the patient, because it was exactly the same setup when I was growing up, having experienced being the person that they're looking at, it's very overwhelming. Like, it's very, if you imagine that, you know, your biggest insecurity is what everybody is focused on and looking at. They're not necessarily worried about what you're saying or doing or thinking, but it's how you're saying it, how you're thinking it, how you're doing it, that you kind of become quite aware that everyone's looking at that one particular area. So as a previous patient in that scenario, I would very much encourage your child to just relax and be themselves. Obviously I'm talking when they're older, but you know, just try not to be too anxious about all of these people staring at that one thing that you don't want them to stare at. And even being on the sort of parent side of things is quite intimidating, because you think everyone's possibly like judging you, or, you know, are you doing the right thing, or is that person going to say something like that, or, you know. And again, I think it's very much like, try and relax, try and just accept that everyone's there for your baby's benefit, and try and just get to know them. You're going to know them for a very long time, and try not to worry too much about how things are going. It's more, if anybody does say anything like, oh, I think you should try doing it this way, again, it's just to get that best outcome for your baby. But they're a fantastic team of people, like as a combination of people. So just use them as much as you can for yours and your baby's benefit.